picture this. It's election year in Washington, D.C. That means we're going to need to take extra security precautions because the threat of terrorism is a lot higher right now. So first off, we've got the Blue Plains water treatment facility. There's an explosion there during the presidential inauguration, and it started a small fire, injuring 5 people. One of the facility workers released anthrax into the pipes. These pipes actually serve 650,000 residents, 18 million visitors every year, 1.6 million in 4 of the surrounding counties in Maryland and Virginia. So if we don't do anything about this, there's going to be a widespread outbreak on our hands. So what can we do when a bacteria is released in one of the world's largest treatment facilities for water? There's 3 options. The 3 options that we have are doing nothing, containing the spread of the disease, and then stopping the outbreak. So for doing nothing, that means upwards of 2.1 million people are going to be exposed to the contaminated water from the facility. With a 40% death rate, we can predict that about 840,000 people would die. With anthrax infections not being contagious person to person, that's a plus, but the only people who do have to worry are consumers of the water, and that's still a lot of people. So that's not a good option. We've got containing the spread of the disease, which doesn't really make sense because it's not contagious. We could quarantine the area of the terror attack, but it still doesn't do enough. So for stopping the outbreak, we would shut off the facility entirely to prevent people from using the contaminated water, and we'll show you the rest of that process throughout our presentation. This map shows what we have established as the radius at risk of the anthrax spread. What we have highlighted basically is we've got the different medical centers, bodies of water in the area, as well as the water treatment facility, and it's all outlined according to the different counties that the water supply reaches. So take a look. Okay. Anthracis belongs to the Bacillus genus, meaning it's a rod-shaped structure with gram-positive walls. It's also a heterotroph, so it can't produce its own nutrients, leaving it to steal its nutrients from other sources. The bacterial cells of Bacillus cultures are gram-positive when young, and in some species they become gram-negative as they age, but for anthrax it's gram-positive all the way through. The Bacillus anthracis genome consists of an approximately 5.3 megabyte chromosome and 2 plasmids. It's also known for its long chains and curly little tail ends, so that's how it looks. And it secretes the anthrax toxin, which is composed of 3 different types of killer proteins, which include the protective antigen, the edema factor, and the lethal factor. So scary.
So in its natural environment, Bacillus anthracis is actually a saprophyte, which means that it lives off of dead or decaying organisms. Now, the spores bacterium is actually very adaptive, which is how it's been able to survive, and it switches between 2 morphologies. The first one is the dormant endospore form, and the other one is the vegetative cell form. So when it's in its vegetative state, that means that the environment has enough nutrients for the bacterium to be able to facilitate growth and division. However, when nutrients are scarce, it uses oxygen in order to create spores, thus turning into its dormant form. Now, these forms are biochemically very different, which means that switching between one another rapidly has actually allowed its dormant form to be able to persist in the soil for decades and decades before it can actually infect a host. Now, because of this effective strategy, the dormant form has actually become resilient in other ways as well, including its ability to remain viable in UV radiation, in extreme heat, oxidation, and other extreme conditions. Of anthrax, we can see how it goes from its vegetative state to its spores form using oxygen, and on the right we can also see that there is a cow, and that is because In naturally occurring cases, most infected organisms are wild or domestic livestock such as sheep, cattle, goats, horses, because we said earlier that anthrax resides in the soil, and so animals are naturally going to have the most exposure to the soil because that's where they live, that's where they graze. So in these naturally occurring cases, when humans are infected, it usually stems from contact with animals, such as if you work with animal hide or if you're a vet. Now, we don't really have to worry about this transmission from animal to human because we are dealing with an act of bioterrorism in our case. However, it is important to mention that this is how most infections in humans occur. So if we look at this picture on the screen, we can see that anthrax can infect a human in 3 modes of transmission, which we will look into much later. So as we go on further into our case, it is important to note now that to contract anthrax, you must come in direct contact with Bacillus anthracis spores, and in other words, it is not person-to-person transmittable. It is possible, however, that anthrax skin lesions may be contagious through direct contact, but this is very rare. So it's important to mention this going forward as we look at ways to solve the problem in the DC and Maryland and Virginia area, so the least dangerous. You already have to have an open wound or lesion and able to contract it cutaneously, and that's because the spores need that open wound in order to get into the host. So specifically in our case, we're going to be looking at 2 instances where people can contract this type of disease. The first one is if people were at the water treatment plant at the time of the explosion, and if anthrax spores were able to get into the air from the pipes or due to the explosion, if people there already had a wound, that it may be able to infect them in that way. However, luckily there were not a lot of people there at the plant because of the inauguration. And the second instance that we're going to be looking at is if somehow the infected water was able to get into facilities and homes and people were able to wash their hands or take a shower, they could also become infected in that way if they were to have an open wound. Now, these 2 cases are not very likely, especially because we are planning on stopping the water before it gets to homes and other things like that. However, we must look at all possible situations. So for cutaneous anthrax, the incubation period is typically 1 day. However, it can take up to 60 days for the spores to become active within the body, which is why antibiotics need to be taken for 60 days to protect yourself from the spores for that long. However, typically it is 1 day. So symptoms include a small group of blisters, typically on the face or arms, or a painless sore that has a black dot in the middle or swelling around that sore. As we said, cutaneous is the least dangerous. 80% of people do end up surviving. However, that 20%, usually what happens is that the infection goes untreated and it travels to the bloodstream or the lymph nodes, and that usually is how people die from cutaneously infected anthrax. It's not because of the sore itself, it is because the infection travels to other places within the body, usually causing organ failure or something like that. Okay, so gastrointestinal anthrax is the next most dangerous version of the disease, and it can happen if infected meat, or in our case, infected water is ingested. The incubation period is typically 1 to 7 days, and the fatality rate is 25% to 75% even with treatment. So when swallowed, the anthrax spores may cause lesions anywhere from the oral cavity to the cecum, which is all the way at the end of the digestive system. So this is why symptoms can lead to swelling of the neck, abdomen, pain and swelling, diarrhea, nausea, vomiting, painful swallowing, any of those. So these lesions that occur in the gastrointestinal tract can cause an infection and may lead to sepsis or septic shock and then death.
So our scenario provides dangers to public health in more ways than just one. For starters, there's the explosion itself. Now, that's not our main focus because, it's not posing a threat of a disease, and it's pretty one and done, though there was reported gas leaking from the site. Now, this is a big concern. There's risk of inhalation of this gas, and that would cause, inhalation anthrax, as well as, contact with surfaces that could get you infected as well. So we should have security monitor this site and avoid the public from making contact with this bacteria. The river is infected as well. If water that has bacteria from the plant dumps into the river, then the river is going to pose a big threat. Uh, you're going to want to avoid making any contact with the river at all, because accidental consumption of this water, or touching it and getting it in a wound or a cut, those could both get you infected, and that parallels to showering as well. You could get it in a cut or drink it in a shower, and that would get you infected as well. You're going to want to avoid soil, particularly very dusty soil. Anthrax spores can live in the soil for quite a while, and inhaling those or making contact with those, with a wound again, that'll get you infected as well. So there's a lot of threats here that, are very dangerous to the public.
Okay, so how does Bacillus anthracis do it? How does it successfully take over a host? Well, after infecting a host, the bacteria releases itself into the bloodstream, and in order to suppress the immune response of the host and therefore promote the survival of itself, it secretes a toxin which is composed of 3 types of killer proteins: protective antigen PA, lethal factor LF, and edema factor EF, which are all seen on the screen. The toxin triplet targets primarily macrophages and neutrophils, which are a part of the immune response responsible for digesting foreign invaders. Individually, none of these 3 proteins are toxic. In fact, they have to work together in order to get into the cell itself. So the PA works to get the LF and the EF into the target cell, and there they stop signaling proteins, which disrupts cellular signaling pathways of the immune response. And in doing so, it prevents the mobilization and activation of neutrophils and macrophages. This shutting down of the immune system can lead to sepsis, and now when this happens, the body calls on the immune system. But since the immune system is already destroyed, these immune chemicals spiral out of control, damaging most organs, and eventually leading to.
So there are a couple different tests you could do to determine if anthrax is a culprit of your symptoms or not, and it differs depending on if you're suspected to have been exposed or not. If you have been suspected to have been exposed, what they do is they'll collect a bodily fluid sample, such as blood for the serum, spinal fluid, sputum, or, they'll swab a wound for that cutaneous infection. They'll take an acute and convalescent sample, and basically what that means is acute is right when the symptoms onset, and convalescent is, a little less than a month after. Those bacteria or suspected bacteria could be cultured on an agar plate, and RT-PCR could be used to determine if anthrax is present. RT-PCR is basically just the process of reverse transcribing RNA to find target sections of a pathogen's DNA that match it, and it denatures and simplifies it into a single strand of amino acids that could be easily evaluated by a lab technician. Finally, a simpler test would just be take a chest x-ray and visually examine it for symptoms such as mediastinal widening or pleural effusion. But for people not suspected to have been exposed, it's a little different, although it's the same premise, I guess. A specimen is taken from a person, specimen was talked about earlier, and it's cultured on a plate, and it could be a different plate depending on what you're testing on. You incubate it for 24 to 48 hours, the standard, and the plate can be tested using a number of different lab methods. For instance, it's just visually inspectable under a microscope. The shape of anthrax is very unique. It's a long chain and it's a rod-shaped curly tail, so easily identifiable. You could also test it on hemolysis, like on a blood plate. You could You could test to see if it lyses the red blood cells or not, or you could test if it's mobile or motile, M-O-T-I-L-E, model, and you could test to see if it moves. There's a number of different ones you could do. Those are just two that we picked out. Alright, so anthrax has only a few treatments that actually are effective. One of them being antibiotics. That's the main one that you'll probably hear of. Penicillin is a great example of an antibiotic. You've probably heard of it before. It's one of the classics. We got antitoxins. Those are needed because anthrax spores, once activated, release their 3 signature toxins, and so the antitoxins will work against that and hopefully prevent more cells from being damaged by these toxins. If it's severe, you're going to want constant fluid drainage. This is because of the edema occurring in the tissues that are dying. It's going to occur mostly in the lungs. You're going to get a pneumonia-like symptom, and so fluid drainage is needed. And mechanical ventilation, because your lungs are going to be so damaged, you're going to need assistance breathing. Okay, so ciprofloxacin and doxycycline you're going to want to take those after being exposed. You don't have to be symptomatic to take these though, and you're going to want to take them for 60 days because an anthrax spore can live 60 days in your body, so you're going to want to take these antibiotics for 60 days just in case they decide to sprout, say 50 days in. You're going to want to be on antibiotics for that. And so preventative measures, you're going to want to wear PPE when you're dressing infected wounds, especially within the first 24 to 48 hours. You're not going to want to use any tap water if you live near the plant, and don't go near that river for any need, really. You're going to want to avoid that river because it's highly bacteria infested and you're likely to get infected if you touch or drink the water.
Alright, so for our case studies, first off, we got a rare case of inhalation anthrax acquired naturally in the southeast Iran. A blind 65-year-old man living in the rural area was admitted with a respiratory infection with symptoms as fever, dyspnea, loss of appetite, and malaise. The patient was treated with outpatient antibiotics a week ago. After admission, the patient was again treated with pneumonia, but there was no improvement despite treatment, and the patient was suffering from septicemia symptoms. Epidemiologists did not discover any specific exposure associated with anthrax infection for the body. However, due to being located in an epidemic and exotic area, it is proposed that the exposure occurred through contact with infected airborne dust or unknown contaminated item. Despite many advances in preventing anthrax, still some rare cases of respiratory and complicated anthrax are emerging. With regard to the threat of bioterrorism, medical staff's sensitivity to the clinical syndrome, methods of prophylaxis and treatment of anthrax must be raised. Fast diagnosis and successful treatment, the lethal cause of the infection, are utmost important. Alright, so for our last case study, Bacillus anthracis was found in the blood culture from a 34-year-old man who had a history of severe abdominal pain, bloody diarrhea, nausea, vomiting, fever, sweating, and lethargy. Within 4 to 5 days after eating the meat of a goat, he had evidence of severe infection and septic shock and did not respond to treatments and subsequently expired 9 hours after hospitalization. Usually, gastrointestinal anthrax develops after eating contaminated meat. When spores germinate in the intestinal tract, they cause ulcerative lesions. Because of the propensity of Bacillus anthracis infection of the gastrointestinal tract process to sepsis or death, both types of gastrointestinal anthrax should be treated aggressively and systematic illness. There we go. There's the end of the case studies.
And finally, we get to our plan of action. So it's important because approximately 2.1 million people are at risk of an infection if we don't act on it quickly and we don't inform them. There's also going to be an importance of surveillance in this little case we have going. It was a crime committed. It was act of terror. So we do have to have FBI or investigations on standby. We also need to outreach to surrounding counties, and we need to keep the general public calm. Counties, because not only should we warn them about our outbreak, but we also should request supplies or water because we cannot produce our own. So the plan, it starts off, we shut off the water and we communicate with other counties that we have a big problem on our hands. An act of terror was committed. We get the PIO to announce it to the public what happened, and we have them tell them to be safe. Then we treat patients and confirm anthrax. We're going to run the lab tests mentioned earlier. We're going to also give the patients the needed antibiotics or preventative measures that they'd need to stay safe. Then we're going to begin FBI investigations on the crime scene. We're going to hopefully find the culprit of whoever did it, or just find out why. Then we're going to have a presidential announcement, and then we're going to trace the spread and watch for the symptoms. So we really have to be careful. Luckily, it's not contagious, so tracing is, it's not going to be as hard as it would be if it was contagious, but we're going to look for the landmarks, like we're going to look for the areas that people are affected, and we're going to hopefully clean those areas out or warn people to stay away from those areas. We're also going to gather supplies. We need our solution that we're going to flush the pipes with. We're going to need water from surrounding counties to give to people while their water is shut off, and just safety equipment. Then next, we're going to actually flush the pipes and hopefully restore the safety in our water system and turn it back on as soon as we can, because people need water. And then after we have the solution figured out, we no longer need water imported, so we can cut that off. We're then going to monitor the public health until the end of the outbreak. Because cases are going to still arise most likely after we get the water back on and it's still clean, because it lives in the soil or the river, so we're going to have to watch for that. And then when it's finally solved, we're going to have an after actions report to round it all off. And that's our plan.